The information provided in this podcast is for educational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Welcome to You Represent Science. I'm Dr. Deb Newitz, a patient advocate and someone who spent years inside a system I eventually lost trust in. Those doubts led me here. Anthony Fauci once told his critics, "I represent science." That claim that one person could own science is exactly what this show calls into question. Patients represent science, their experiences, their stories, their outcomes. So I call this show You Represent Science because you do. This is so concerning to me that my guest unexpectedly canceled. Her patients needed a neutral presence and a safe space for patients across the political spectrum. First of all, I wish we'd had a dialogue of what she viewed as being political, because I would have removed that from the content. Secondly, I think the safest space a patient can experience is a doctor who's informed and evolving and questioning and really treating the person, the patient, like a person, an individual. I view this podcast as being actually very apolitical. And I believe that the political impact on medical care has actually destroyed the industry. And deviating from these mandated guidelines will actually improve medical care. I was also told that she wanted a safe space for her patients. And I believe the safest space for patients is when a doctor truly cares about who you are and is willing to work up your problems and deviated from these mandatory guidelines. The problem with medicine today, and what actually occurred in the podcast today, is a reflection of what's going on, is the medical community has been completely abandoned by psychiatrists. They are either charging exorbitant prices for private pay, or the ones who've chose to stay in the system and are charging insurance rates or seeing their patients every 15 minutes. They're not working them up for secondary causes. So oftentimes patients are slapped with medications really quickly, and they are often missed like secondary causes. Their physical exams are brief and inferior, and the medical causes are not investigated. And so sometimes they are subjected to a lifetime of medications when it could have been a treatable cause of a disease. One of the concerns that I have about medical care now is we mentioned the word criticism. And if you deviate from the expectations, it's not often a criticism of science, it's an evolution of science. And so people are not as open to having conversations now. That is my major concern in the medical community. And we don't realize we view it as a criticism, but in fact, it's actually an advancement. So I wish I could have had a dialogue with this psychiatrist about how advancing medicine and treatment of patients is political. This reflects that my concerns that any time we deviate from what is expected or dictated, that it's considered a criticism of science, whereas in fact, it's evolution of science. Our aim should be really treating patients and having good outcomes, and the patient should feel and be better. I was very upset that we couldn't even have a conversation about what in particular was concerning this psychiatrist about appearing on the podcast. And that, I think, is what is lacking in medical care right now, is nobody's willing to have a conversation. Everybody's using keywords like a neutral presence, cancel culture. We don't even know what that means anymore. Why don't you choose your own words? And that's the problem with medical care today. There's no individuality. There's no self-expression. It's really viewed as robotic factory line work as opposed to being an independent chef. Medicine should be fun and creative, and the goal should all be that patients feel and are better. So in comparison, if our laws weren't evolving, I wouldn't even be able to sit here. I wouldn't have even been able to attend medical school or even possibly college. Actually, I feel devolved. I feel like medical care was better 30 years ago when I could learn on my own, learn through patients, learn through some of the literature. Medicine's constantly changing on a daily basis. I learned from my patients as a physician, but through my friends, my family, my neighbors, I am actually learning every single day when they give me feedback about what's going on in their lives. Like, for example, my son called me up the other day and his blood pressure was elevated. And his doctor saw him really quickly, didn't even question his diet. It turned out that he was taking these pre-energy drinks, and I told him to stop it, and his blood pressure immediately improved. And the problem was his blood pressure not only was elevated, it was affecting his kidneys. And I said to him, what was your response when the doctor told you had high blood pressure? And he said, she said she'll check it again. And she never even bothered to check it again. So I feel that the problem is with medicine, we have to stop being so sensitive. We have to stop being so concentrating on criticism. This is not criticism. The point of our society is we need to feel better and we need to be healthier. And none of these other issues matter if we're not healthy. So my first topic is on B12 deficiency. I started to think about what are hints that a medical disease can cause a psychiatric problem. And then I started to think about all these patients that have been battling psychological issues for years and they never had a medical workup. So I think that all psychiatric patients should get a complete physical examination and blood work, and I will review which blood work should be done. But it should be a blanket situation that all patients are getting a full physical examination and all the blood work that I recommend. One of the interesting points of a medical cause that can cause a psychiatric disease is B12 deficiency. I had a patient referred to me by a psychiatrist, and I was very impressed because the patient developed new onset anxiety and depression, and she had drawn a blood test for B12 and it was low. And I was really impressed that this physician thought enough to not just add medication, but to start investigating why this was actually happening. So I want to inform my viewers of signs that can suggest B12 deficiency. So B12 deficiency can present as anxiety, depression, and any other psychiatric illness, but you also want to consider it if you are going into heart failure and you have any kind of shortness of breath. It should also be considered if you have any evidence of malabsorption, such as diarrhea, any other neurological or psychiatric issues, such as memory loss. Additionally, you're more prone to neurological issues, so you can experience more broken bones. If you have any kind of anemia, you're pale, you're fatigued, you have any chest pain, also think about B12 deficiency. One of the other issues that I see is frequently the B12 level can be low, normal, and a patient should have their bloods drawn to check to see if they have an elevated homocysteine and methylmalonic acid levels. Many patients frequently told that they have a normal B12 level, and they have the symptoms of B12 deficiency, but the level is actually low normal. So these blood tests can be more sensitive in detecting earlier diseases. if you're experiencing any weakness, shortness of breath, insomnia, memory loss, or numbness, please get a B12 level. If your level is below 400, it might be ideal to get checked for elevated methylmalonic acid and homocysteine levels. Many patients manifest with B12 deficiency, but they're not picked up because the B12 level is actually low normal range. And these other blood tests are better at predicting that you have that problem. All of your symptoms can float away. I've seen patients with a disease called cardiomyopathy, heart disease, and if they have low B12 levels and you prescribe them, you give them B12 injections or pills, all the symptoms can completely be removed. I've seen patients that are completely demented, memory loss, numbness due to neuropathy. Treating patients provides them with hope. So many physicians nowadays are dismissive of the symptoms. And it saddens me to see so many patients completely recover from their medical illness with treatments that are not investigated at all. Now moving on to the gut-brain connections, the celiac disorder is another medical problem that is completely overlooked. And I've learned so much about this disorder over the last couple of years through my patients. My first niece, when I saw her as a young child, it made me so sad. She was so anxious and so depressed. And I always had a gut feeling, no pun intended, that she had celiac. She was very little and very thin. And she just had an appearance that there was something wrong. And she was actually told that her blood tests were normal. And I recently reviewed the blood tests myself, and they were actually abnormal. And she had reportedly a normal upper endoscopy, but she clinically has celiac. And once we put her on a gluten-free diet, all of her symptoms were improved. So she had no anxiety, no depression. She's actually taller than I am. She looks healthier. And I just find it very sad that this disease is completely dismissed. My second niece, it was really interesting. She didn't develop any symptoms until she was a late teenager. And so my sister-in-law at that point was really familiar with the symptoms and knew there was significant family history. So she immediately got the blood work, which suggested celiac, and had an upper endoscopy, which confirmed it. The role of upper endoscopy. So this is another issue that if you read the textbook, upper endoscopy is recommended as the gold standard in confirming that you have celiac disease. The upper endoscopy is difficult to obtain. It's expensive. It's invasive. The blood work is much more suggestive of the disease, and that's often dismissed. My sister-in-law also mentioned, so it was the father of the two nieces, that her husband was checked for celiac and was negative. So I had her send over the blood work to me, and he only had one of the 3 tests done. So if you have celiac, make sure that you have the 3 types of blood tests completed, which are tissue transglutaminase, IgA, anti-gliadin, and endomycin antibodies. My sister-in-law called me up and told me that her husband did not have celiac on blood work. I knew that this was probably a misdiagnosis. He's had long-term abdominal pain. He has bad arthritis, and he's a young guy. And both his sister and his 2 kids have celiac disease. So she sent me over the blood work, and I realized they'd only done one of the 3 blood tests. So this is another example that blood tests and workups are often incomplete. They're just dismissively told that the test is negative, and their symptoms and their ongoing life battles are just completely dismissed. And that's what I just find so sad, is that people are oftentimes battling issues and feeling miserable, and this could be so easily treatable. Another example of a medical disease that is completely neglected is infertility. So I learned through one of my patients that any patient with infertility should get the 3 panels blood tests for celiac disease. I had a patient that I knew for many years, and when I first met her, she was about 30 years old and perfectly healthy, but completely infertile. And her blood tests were suggestive of like a 50-year-old menopausal woman. And I always found that concerning. I did what I thought was a complete workup at the time. And she then required an egg donor to have her only child. It wasn't until years later that she developed this rash, and I'd seen many patients with this rash, and I thought, oh, okay, this could be celiac disease. And I checked her for celiac disease, and it made me so sad because she did have celiac disease. And if I had met her years before and I'd learned that, celiac can present as infertility, maybe I could have preserved her ability to have a child. So that saddened me, but it is something that I always tell any of my patients, any of my friends, family members, that if there's any concerns about infertility and childbearing, the 3 blood tests for celiac disease should be done. Another cause of psychiatric diseases, such as anxiety and depression, can be caused by food allergies. I was really impacted by one of my patients who was approximately a 50-year-old man who came in with his wife, who looked very concerned, and he had anxiety and depression and a complete litany of symptoms. He had chest pain, trouble breathing, stomach pain, joint pain. I couldn't even keep up with all of his symptoms. And I said to myself, okay, well, let's do a food allergy blood test. So I learned that from one of my colleagues, that checking a food allergy blood test can be very helpful. So it turned out this patient was allergic to nuts, dairy, and shellfish. And we eliminated it from his diet. And when he returned to me, the change was completely dramatic. First of all, he was not accompanied by his wife, and he was completely better. So changing somebody's diet can improve psychological outcomes as well as their entire physical being. So I've seen patients present with a whole array of symptoms, and they are the change is dramatic and impressive when you eliminate certain foods that they may be allergic to. Another medical disease that can present as psychiatric, such as anxiety, depression, is Lyme's disease. Lyme's disease is a very important neglected disease. One, because it's often dismissed as psychiatric in origin. And another is that they're completely doing the wrong tests. So the Western blot, which has 95% specificity, is often not recommended. And the ELISA, which only has a 35% sensitivity, is recommended. So oftentimes Lyme's test is not even done, or if the blood test that is completed is the incorrect test. So please remember to recommend the Western blot test, not the ELISA test, to your physician. So one patient that I learned a lot from was a woman who was postpartum, and all of a sudden she was a very healthy person who I'd see once a year, and all of a sudden she was going to the emergency room with panic attack. And I said to myself, this is very strange. She's a very healthy person. It's completely being dismissed as postpartum, which, so is another one. I thought the timing was very interesting. So I did the Lyme's Western blot. We gave her a quick course of antibiotics, and her panic attacks completely resolved. But what was interesting about the case is this was a woman who the symptoms were really extreme. She had never experienced panic attacks before. So case in point, again, all psychiatric diseases should have certain blood tests checked, especially Lyme's. Lyme's is another disease where if you read a textbook, it only recommends evaluating it if you develop carditis or heart block, a rash called erythema chronica, migraines, neuropathy, a facial droop. One of my first encounters and learning curve with Lyme's is a patient that didn't have the ELISA test, but actually had the Western blot test. And you either have to have 5 bands or 2 bands on these 2 different types of Western blot tests. And I remember meeting her, and she had, as usual, a complete array of medical concerns. She said she had chest pain, heart racing, anxiety, depression, joint pain, fevers. She didn't have the confirmation of having Lyme's disease. She only had 1 band that was positive as opposed to the 2 or the 5 tests bands that were positive. And she had actually seen several of my colleagues who completely dismissed her symptoms as well. And so I gave her a couple of weeks of antibiotics, and I said, continue it until you feel all better. When she returned to me a couple of months later, I learned so much from her that I thought I gave her the antibiotics and her symptoms completely resolved, and then I didn't see her again. But she actually got in touch with a rheumatologist who practiced very similar to the way I practice. And the patient actually had to have various regimens of antibiotics for several months. So patients unfortunately want an answer. They want to be told, take the antibiotics for a week or 2 weeks. I've had so many patients who, one patient will require 1 week of antibiotics. I've had patients who require a year of antibiotics. So the problem also with treating Lyme's is doctors aren't patient enough. And you have to, once again, treat the patient like an individual. And it is not like a one size fits all. And some patients require more extensive treatments than other. I had another patient that I learned so much about Lyme's, and she had also psychiatric symptoms as well as the typical fatigue, brain fog, chest pain, trouble breathing, joint pain, muscle aches. And what I found so sad about her is when I first met her, her husband had left her and she'd lost her job, and nobody believed her symptoms. And so we did the typical Western blot test, and the presentation was atypical. She didn't have the 2 or the 5 bands that were positive. She only had like 1 band that was positive. But this disease had completely destroyed her life. And we ended up giving her antibiotics, I believe, for years. So she had pills, and then I gave her injections, and then we actually put a PICC line, which is a permanent IV line, in, and we gave her intravenous antibiotics for months to years. And I remember feeling so sad because she would always reassure me that she was 80% better. But yet my goal was to make her 100% better because she had lost everything. She lost her career. She lost her husband. She was sort of consoling me that she was like, this is so much better than anybody else has done. But I always felt, and this is the way every doctor should feel, is that you should make your patients 100% better, and you should not rest until then. And unfortunately, doctors now really complete the recommended course of treatment and then just wash their hands of the situation and roll their eyes. And you have to remember that we're treating people, and this can decimate their lives completely, as opposed to we chose this field to improve life quality and not become robots. Another disease that can present with psychiatric symptoms is hypothyroidism. So my son's girlfriend called me up, and she said that she started to develop feeling fatigued and joint pains and missed periods and felt generally unwell. I was concerned because she already had the diagnosis of hypothyroidism or low-acting thyroid, and she sent me a picture of her thyroid blood test, so TSH, and the TSH was abnormal. And her doctor once again dismissed it and said, oh, your blood tests are fine on the thyroid medications. The most important point is if you have thyroid disease, the TSH has to be completely within normal range. And I find that so many physicians are neglectful in being completely conscientious in obtaining completely normal results. I had to actually increase her medicines on my own in order for her to obtain a normal TSH or blood test. As her blood tests completely normalized, all of her symptoms dissolved and she returned to being a completely healthy young person. Another time I was exposed to a patient who was actually my friend. We were outside, it was the winter, and she was completely hot, and she was complaining to me that she was anxious, depressed, short of breath, missing her periods, joint pains, muscle aches. And I said to her, have you ever had a blood work checked? And it was actually ironic because she's a physician. And she ended up having hyperthyroidism, which was overactive thyroid. So any of these symptoms can present as a thyroid disease. So either low acting or overacting thyroid, you can present with weight changes, trouble breathing, chest pain, hair loss. So the most important concern I have with thyroid disease, it's often detected and easily checked for, but physicians are very casual about making sure that the blood test is completely normal. So if a patient does have thyroid disease, make sure the TSH, which is the blood test that's the most sensitive, is completely within normal range. So thyroid disease can present with psychiatric symptoms such as anxiety, panic, depression. But it also should be suspected if you're experiencing any weight changes, heat or cold intolerance, chest pain, trouble breathing, diarrhea or constipation, muscle aches, joint pains. The concern I have with thyroid disease, I so frequently see physicians check the blood work for it, but almost play the game halfway through and don't follow through. So it's really important to make sure that your TSH, which is the best blood test to get, to make sure that's completely within the normal range. Doctors check the blood work very frequently, and that's not an issue, but it's almost like they don't complete their treatment of the disease and make sure that the blood work is completely normal. Another medical disease that can present with psychiatric symptoms is menopause. And I really do view menopause as a medical disease because it often does require medications, and you have to be very flexible because some people glide through menopause and there's no change in symptoms. Some people do experience really dramatic symptoms. So if you have trouble sleeping, hormone replacement can be very helpful, as well as night sweats. If you're experiencing weight gain, bupropion can be extremely helpful. The other SSRIs are very good for treating hot flashes, but Wellbutrin or bupropion is the most helpful medication in treating weight gain with menopause. Another medication that's very good for treating palpitations, which is frequently seen in menopause, is buspirone or Buspar. Patients more and more are not getting adequate physical examinations. And my friends always laugh at me and say, oh, when I went to the doctor, is this what is correct? And a complete head to toe exam should be done on everybody, literally head to toe. So men and women should get a breast exam. And I've seen many men have breast cancer, and so they should get a physical exam as well. Rectal exam should be done for everybody over the age of 40. A pelvic exam should be done on every woman every year. So oftentimes the the medical community has interpreted a pap smear, which should be done every 1 to 3 years, depending on your sexual activity and partners, has been overinterpreted to getting the same pelvic exam every 1 to 3 years. And that's completely false. So for example, I had a patient come in who's 30 years old, and she appeared to be completely crazy. Her list of complaints, and I spent so long talking to her about her history, and she seemed very anxious, depressed, and she had chest pain, trouble breathing, stomach aches, joint pains, rash, everything. And very quickly, when I did a physical examination on her, she had a thyroid mass. And I had never met her before. This was the first time I had met her, and she appeared completely crazy. Ultimately, she was diagnosed with thyroid cancer, and it was removed. And it was very impressive how much she changed. So she came in after her thyroid was completely resected. She had no symptoms. She was not anxious. She wasn't depressed. She had no symptoms. So this is another situation where a complete physical examination can come up with the answer or the solution to the patient's concerns. And it's so heartbreaking to see time and time again, people have a very treatable early disease and they are neglected. I had one patient, it wasn't picked up on physical exam, but she came in, I didn't know her that well, and she was anxious and depressed, and she had so many complaints. She had stomach aches, chest pain, trouble breathing, everything. And we did round after round of tests, and it turned out she didn't have gallbladder stones. She had gallbladder dysfunction, and I referred her to a surgeon. He said, Deb, I can take out her gallbladder and treat all of her abdominal complaints, but all of her other crazy symptoms are not going to get better. When she returned to me after her gallbladder was removed, and she was actually ended up being one of my favorite patients. She really, and I remember calling the surgeon and saying, you not only cured all of her stomach issues, but you cured everything else, and she's actually not crazy at all. Medications should always be looked at to see if they're causing any symptoms. So frequently, asthma medications, ADHD medications, and even oseltamivir or Tamiflu for influenza can present or cause depression and anxiety. Sometimes it can be very difficult because I've seen a lot of medications present with adverse effects weeks, months, years later. So oftentimes you have to stop each medication at a time to just figure out what the problem is. So I've seen patients, I had this one patient a long time ago who presented with a cough, and she had been on medications for years. And typically ACE inhibitors, it's called, and ARBs for blood pressure can present with cough, but usually very quickly. This patient had been on this medicine for years. I stopped the medicine, and she had this extremely exhaustive workup. She had had like bronchoscopies and I think lung biopsies and cardiac tests, and it was crazy. All what I did was stop the medication, and the next day she was all better. And I see this a lot. So a lot of times you can present symptoms of a psychiatric disease, and it can present after you've been on these medicines for years. And it's very difficult because a lot of times people are on 20 different medications. So it has to take a lot of time in stopping each medicine one at a time for a day or two, and then going back on it and seeing if the symptoms appear or disappear. Many medications cause side effects, and it can be difficult because it doesn't always occur after they've been on it immediately. It can be weeks later, months later, years later, and it can be very confusing. Oftentimes, you can develop a side effect that's not even described in the literature. So when I first started practicing, I gave this really cute guy, he was like 80 years old. He was really cute and he had high cholesterol, and I gave him cholesterol medication, and he came back to me and he said that he had memory loss and some anxiety. And so I said, oh, this is really a big problem. You have memory loss. And I looked it up in the literature, and there was no literature ascribing cholesterol medications to causing these symptoms. So I ordered a very expensive, huge group of tests, such as CAT scans and MRIs and all these tests. And he said, do you think it could be my cholesterol medication? And I said, no, it's not described in the literature, and the literature is always right. And he came back to me a couple of months later, and I remember saying to him, but you didn't do any of the tests that I recommended. And he said to me, no, I stopped the cholesterol medication, and now my memory's fine, and I feel great. So it was very funny because it really taught me anything can cause anything. And you have to continuously listen to your patients. And sometimes they, in their sort of unmedical way, will tell you what the problem is. And you can't just stick to a textbook. You have to listen to the patients, and you have to continuously evolve and change and respect what they think is going on. And oftentimes the patient is right. Psychiatrists are being pressured to see more and more patients, so they can't look at the basics. So whenever I see any medical issues, especially psychiatric, a simple change in diet, exercise can really change a person's outcome. So oftentimes I tell the patients the best foods to eat are fruits, vegetables, fish, nuts. And if you're concerned about your mental health or memory, the best foods to eat are cereals and honey. So oftentimes little things like changing diet, cutting back on alcohol, eliminating cigarette smoking, and exercising every day for 30 minutes can make the difference between treating your psychiatric disease. So the problem is right now, there's so much emphasis on quickly treating somebody and just slapping a medication on them, whereas basic preventive medicine can really make somebody feel much better and get rid of all their concerns. A couple of years ago, I learned so much from this one patient who told me that she had memory loss, and I had just read that cereal was one of the best things for treating memory loss. So I told her to go have some cereal every day and also cover it with honey. And she came back a couple of months later, and I said, how's your memory doing? And she said, it's fine. Why are you asking? And I said, because last time you were complaining about your memory. And she said, really? I don't remember that. So I said, did you change your diet at all? And she said, yeah, I started eating Raisin Bran and honey every day. So in the future, it was very funny. So I specifically going forward said to patients who had any memory concerns, try to eat some cereal, but in particular have Raisin Bran. So this patient whose memory loss completely resolved while eating Raisin Bran and honey was such an important point, because it showed that I continually had to read and investigate from everything about how to improve memory loss, like in terms of blood tests I have to do, but even simple fixes with diet. Memory loss can be so detrimental and have such a huge impact on somebody's life. And for this to show that just a quick fix in changing your diet can affect your life so much is important. So many people are reluctant to start medications to help people stop smoking, such as Wellbutrin, Nicoderm, or Chantix. And they don't realize that a lot of times the medications and the treatment to help people stop smoking is so much more important than letting them continue to smoke. So oftentimes it's a struggle with patients. And I've learned that just if you keep at it with patients and you don't give up ever, that even weeks, years later, if you get them to stop smoking, that is going to prevent the number one cause of death, which is heart disease. So I think my point is never give up on your patients and never have a doctor give up on you. So even subtly adjusting your alcohol intake can have such a huge impact. So especially since I've moved to Tennessee, I see a lot more socializing with alcohol, and it's considered part of normal life. And there has been shown that drinking 7 drinks of alcohol per week or more can really affect you. I actually had this one patient who was an oncologist specializing in breast cancer, actually. And she was having about 2 drinks of alcohol a day to address her anxiety and frustrations. And on simple physical exam, she had a breast cancer, and she wasn't even doing her own self-exam. And so she was treating her own anxiety with daily alcohol. And a simple fix like that, I mean, by getting her to stop drinking alcohol, who knows how many cancers we can prevent in the future. I had a patient who was a young guy. He was in his early 20s, came in with his mother, and he was being evaluated for seizures. And just on history, I said to him, "Are you drinking any alcohol?" And he said, "Yes." And I said, "How many drinks a week?" And he said about 20. And I said, "Just on the weekends?" He said, "Yes." And I said, "Okay, you're having the seizures. Have you noticed that you have seizures a certain day of the week?" And he said, "On Mondays." And I said, "Well, then you're having alcohol withdrawal. And so the answer is to stop drinking." So even just taking the time with patients and getting a little bit of a better history, adjusting their diet, getting them to stop smoking and cut back on the drinking really can make a huge difference in people's lives. I think it's really important for psychiatrists and primary care physicians to look at causes of psychiatric diseases. And so certainly a quick fix in diet and exercise is very important in deferring from medications. I do think that after you have done all these lifestyle adjustments, that there is tremendous room for SSRIs. And I really believe in those group of medications. And I know people tend to be very pro or against them. They're prescribed too quickly, but if they do make your life better, it's really important because I always say to my patients, you deserve to be happy. And even if it's a pill that makes you happy, then I think it's worth it. On one hand, I am concerned that we are starting medications too quickly and that diet and exercise, tobacco cessation, alcohol, decreased consumption is instrumental in treating patients. But once those changes are made, medications, I am a big believer in medications, a big believer in hypertensive, cholesterol medications, depression medications, cardiovascular disease. The number one cause of death is heart disease, and treating those diseases, tight control with blood pressure medicines, cholesterol medications, has shown to prolong people's lives. And I've seen it in my own practice. So every time I've started a new practice, you get excessively sick patients in the beginning because they're frequently discharged patients from the hospitals who have not had access to care. And just by simply controlling their basic problems, their blood pressure, their diabetes, their cholesterol, whether it's diet, exercise, or medication, has repeatedly shown to keep my patients out of the hospital. The problem with mainstream medicine is there's a complete divide and there's nothing in the middle. And I think we need one faction that completely and blindly adheres to the medical decision-making and recommendations. And there's the complete other end of the spectrum where people are completely resistant and fearful to traditional medication. So we need to start working more together and listening to each other, because both ends of the spectrum can be correct at times. We need to use a combination of care and methods on both extremes. So I just want to wrap up this podcast that in closing, anybody who has any concerning psychological issues, they do deserve a complete physical examination and blood work for B12, thyroid, Lyme's, and celiac. I've often seen so many patients have their concerns dismissed when they actually have a treatable cause of their disease. I think the sad thing is I've had so many patients, family, friends who ask me for recommendations, and I literally write out the things that should be checked and tested for, and they are blown off by doctors. So when you ask for my recommendations about what to do and how to advocate for yourself, I don't know what to say. But I'm also starting to say that if patients are not getting a full physical examination, they're not getting the blood tests, they should ask for a refund. Because I think it's horrible that people are paying expensive copays and taking a day off of work and going to a doctor. And I'm so tired of hearing my friends and family members come back and they say the doctor did nothing. They did not do a complete physical exam. They did not do the blood work. They're rolling their eyes at them, and their concerns are dismissed. I mean, there's so many treatable issues out there, and patients are just getting blown off, and I don't know what to recommend, because I've literally written it out for them what to get, and the doctor just doesn't do it. That's it for today's episode of You Represent Science. If something we discussed resonated with you, if you have a story of your own, or if you have any questions you'd like explored on the show, I want to hear it. These stories and questions matter, and they deserve to be heard. Write to us at yourepresentsciencepodcast@gmail.com. Come find us in social media and keep the conversation going. All the links are in the description. Thanks for listening.